Video you will learn about myasthenia gravis. So what is myasthenia gravis? This is the autoimmune disorder, so which can cause weakness in the muscles throughout the body or in certain or on certain parts of the body, on face or on leg, okay, or respiratory system or any other organ, okay, or throughout the body it can cause muscle weakness, okay. So this is not normal type of muscle weakness. So this is the disease oriented muscle weakness which can cause relaxation, for permanent relaxation, and it may give the patient fall down property, okay. So the patient cannot properly stand up, okay. So this is about myasthenia gravis, and this is the autoimmune disease. So what is autoimmune disease or autoimmune disorder? So when body system is not able to fight against its own mechanism of the body, means if immune system is going against your body's some own parts or own mechanism, okay, so it may cause depletion of the immunity. Means, again I am telling, means immune system when detecting our body's own cells, okay, as a antigen, as a foreign particle, and it is making its own antibody to fight against that particular substance or particular cell to destroy that one. So that is called autoimmune disorder, okay. So this is one type of autoimmune disorder, and like leukoderma is another type of autoimmune disorder, and rheumatoid arthritis is another type of autoimmune disorder. So these are the there are many other types of autoimmune disorders also, but these three types I told you: leukoderma, rheumatoid arthritis, and myasthenia gravis. So what is autoimmune disorder? Already I taught you that it will destroy our own cells mechanism, means our immune system, particularly T cells, okay, which is fighting against the foreign antigens and producing antibody to destroy that thing which is coming from outside. But if it is fighting against our own any cell and destroying that one, then it is called as autoimmune disorder. So let us move. So myasthenia gravis, this is an autoimmune disorder where antibodies are produced. So already I told you that our body will producing antibody against NM receptor, because this is I am talking about myasthenia gravis. So if against NM receptor means neuromuscular junctions having receptors, nicotinic receptor, that is called as nicotinic receptor. N for nicotinic, M for muscular. So nicotinic muscarinic receptor, okay, that is called neuromuscular junction. So against this nicotinic receptor, if our body immune system is producing antibody against it, so what will cause? It will causing decrease in the number of NM receptors, means the receptors count will be reduced in that particular muscle or in that particular part of the body, okay. So what will happen if NM receptor is reduced? Then what will happen? No proper releasing of the acetylcholine, because acetylcholine is the neurotransmitter in peripheral system to involve in the contraction of the muscle, okay, contraction of the muscle, okay. So here patients particularly who are having thymoma, so thymoma means it is a type of tumor which producing tumor in the thymus gland. So where thymus gland is present? Here in our breastbone upward here, okay, our behind breastbone thymus gland is there. So this is the gland which is responsible for producing antibodies, which is responsible for producing T cells, lymphocytes, okay, which is responsible to produce the antibodies to fight against the antigens. Okay, so this is the gland which is responsible to fight against diseases. Okay, which is responsible to improve our immunity. Okay, so if thyroid gland is producing tumor, okay, means enlargement of thymus gland, then it is called as thymoma tumor. Okay, so later it may produce cancer. Okay, so thymus gland, in thymus gland thymoma is produced. Okay, and if this thymectomy, by doing thymectomy means removing this thymus gland, so the probability of reducing of the myasthenia gravis will occur. Okay, so complete removal of the thymus gland. So you may have the question that if thymus gland is responsible for immunity, then after removal of thymus gland, what will happen then? What about the immunity? So already whatever the produced immune cells are there circulating in the body, those will fight against the antigens. But is this good? No, obviously not. But in case of tumor, it should be removed. But in adult, if this is removing, then there is less problem. Okay, but if in newborns thymus is going to remove, then infectious diseases can cause that newborn, and it may be fatal for newborn baby. Okay, so for adult little bit okay. Okay, so by removing this is a procedure through which removing the thymus gland, so thymectomy. Okay, so can induce remission. So most probably patients, okay, with having thymoma, they are producing myasthenia gravis like disorder, means muscle weakness in face or in respiratory or any other organs. Okay, so which will causing the muscle relaxation and may give fall down. Okay, result of fall down. Okay, no proper stand up or no proper work can done by that person. Okay, so what are the signs? Typical signs and symptoms are weakness and easy fatigability. Means he will feel every time weakness, okay, all through the muscles, and fatigue, again laziness. Okay, then how could we detect that either the person is suffering from myasthenia gravis? So this is the test, okay, that is called as hydrophonium test. So this is the agent 2 to 10 mg induced in that particular person. If we are supposed to see that myasthenia like property in that person, okay, weak muscle weakness more in that person, so we may test this one, hydrophonium test, by to detect that person either he is suffering from myasthenia gravis or not. So through IV given slowly and can improve the symptoms. So if someone is suffering, so by doing this test, it could be detected. Okay, but not in other muscular dystrophies, means other muscular weakness may occur. So if other weakness is there, so it will not detected by this test. But if myasthenia gravis is there, it could be detected by hydrophonium test. Okay, then circulating antibodies to NM receptors. Okay, so if providing antibodies in the NM receptor, so if it is binding, it will cause the myasthenia gravis. So for detection. Okay, so other effects, what will happen, who the patients are suffering from or having the myasthenia gravis, so their eyelid movements will be disturbed. So what will happen? Ocular myasthenia gravis means one type of eye problem is that in myasthenia gravis, ocular myasthenia gravis include double vision. So if someone is suffering from myasthenia gravis, then it could have double vision, means image producing single image twice, means seeing the any one image in twice. Okay, means double. Okay, then drooping eyelids, means his eyelid will be dropping here. Eyelids will be droop, means a little bit shrinking. Okay, it will show not normal as, okay, so drooping eyelids. Then facial, second is the facial muscle weakness. So our smiling capacity, okay, and chewing capacity, swallowing capacity, and talking difficulty will occur. The patients who are having myasthenia gravis. Then respiratory level, respiratory muscle weakness or will cause abnormal breathing pattern. So these are the symptoms or other effects of myasthenia gravis patients. Okay, so what are the treatment? Treatment is by increasing the acetylcholine release. I'll tell the mechanism later. Okay, so by increasing acetylcholine release through the drugs like neostigmine and pyridostigmine, and these are the anticholine esterases. So what will happen by this drug? Just I am going to explain after telling these all. Okay. So then immunosuppressants means the agents or drugs or medicines which can suppress the autoimmunity. Okay. So by that way it would not produce antibody. Okay. So immunosuppressant drugs like prednisolone 30 or 60 mg per day. The patient will recover 80%, and recovery dose, okay, maintenance dose is 10 mg. Okay, alternatively means alternate days it should be given. So for most patient it could be recovered up to 80%. Okay. Then other drugs, other immunosuppressant drugs like azathioprine and cyclosporine. So this could take up to 1 year. Azathioprine could take to effect to normalize the muscle contraction and relaxation up to 1 year. So this is not good to use, but cyclosporine within 1 to 2 months it could produce the effect. Okay. Then these drugs could inhibit, okay, nicotinic receptor antibody synthesis. Means in nicotinic receptor the antibodies which are produced by our immune system, so they are binding with that receptor, so by that way decreasing the mechanism of the acetylcholine. So these drugs could inhibit that NR antibody, means nicotinic receptor antibody synthesis reduction or inhibiting. Okay. Then plasmapheresis. So the patient who are suffering from the myasthenia gravis, by the help of plasmapheresis means exchanging that person's plasma. Okay. So it could remove that effect, means removing the acetylcholine problem. Okay. Means there is no proper releasing of acetylcholine or there is no proper binding of acetylcholine because of lack of receptors availability or receptor, nicotinic receptor. Okay. So three methods are there: by increasing acetylcholine release, or through immunosuppression means through suppressing the immune activity, means producing the antibody, or plasmapheresis. So by these three procedure we can relax this myasthenia gravis symptom. Okay, or we can do the treatment. So how the mechanism of action is there? So now I am drawing. So this is the disease which is in peripheral system, not in CNS, not in central nervous system. So this is autonomic nervous system disorder, okay, which is causing autonomic nervous system, okay, or peripheral system. So all of you know that this is the nerve, particular presynaptic nerve. Always I am drawing, in other videos you can see, okay, and this is the postsynaptic nerve. Okay, here I am this is, you can say this one as a muscle. Okay, this is, you can say as a muscle. Okay, because these two, means this nerve ending, okay, is connecting with neuromuscular junction, means neuron and muscle, neuromuscular junction. Neuromuscular junction. Okay, so here vesicles, okay, having neurotransmitters of choline, neurotransmitters of acetylcholine, which are released, okay, by dissociating this vesicle through calcium ion, okay, calcium ion, and these are released here, over here, but these could be reuptake, okay, or destroyed by choline esterases. This could be, these neurotransmitters could be destroyed by choline esterase or reuptake by, okay, other mechanism, okay. So if choline esterase is destroying these neurotransmitters, then there is no contraction, right? There is no contraction because acetylcholine is responsible for contraction of the muscle. So if anticholine esterases are applied, the drugs already I told you, so it could remove, like neostigmine, okay. So if acetylcholine is releasing here, so by destroying this choline esterase, through destruction of choline esterases, the release of acetylcholine will be disturbed and contraction will be reduced, okay. So one method of treatment is anticholine esterases drug like neostigmine, and another one, that suppose this is the receptor. So if immune cell, like what, this is immune cell which is coming and binding with this one, this receptor. So I am showing you on red, with red, okay, here. So this is the receptor. So suppose here some antibodies came from where? From your immune system, okay, thymus gland, and binding with the receptors. So availability of the receptors could be reduced. Number of receptors are lost because they are binded with antibodies. So these are binded with antibodies, okay. So if availability of receptor site is less, then releasing of neurotransmitter could not bind with the receptor, particular receptor. So what will happen? There is no response of the muscle relaxation, muscle contraction or relaxation, okay. No response of muscle contraction. So if immunosuppressant drug, immunosuppressants already I mentioned, so you can rewind it and see, suppressant drug, this drug could reduce the secretion of or release of antibodies. So by that way, again opening the site to bind acetylcholine, okay. So plasmapheresis means, already I told you, that affected antibodies through removing of the plasma, exchanging of the plasma, that antibodies, over excretion of antibodies could be removed, okay. By that way, effect of myasthenia gravis could be controlled, okay. So this is all about mechanism of action. So this is mechanism of action. So here what happened? One is, if destruction of acetylcholine release is happening by the choline esterase enzyme, so it could be controlled by anticholine esterase drugs. If more release of antibodies are there which are binding with the acetylcholine receptor, means nicotinic receptor on the muscle, so it is stopping the binding site of acetylcholine. So if immunosuppressant drugs are given, so it could reduce the production of antibody. By that way, again opening the site of receptor, okay, nicotinic receptor. So by that way, myasthenia gravis can be stopped or controlled. So this is all about mechanism of action and classification of drugs, and what is the disease or what is the disorder of myasthenia gravis. So hope so that you understood this lecture, okay. So like, share and subscribe. So one thing you remember, that I am making the videos by referring so many books and so many sources for you only. So please don't escape any video. So many videos I have uploaded previously. So you watch full of those videos and you like, share and subscribe. You motivate me. I will give you full sources and full references of study oriented, whatever the main topics are there, I will provide you. So don't worry from my side, but your duty is that you please watch full video every time. Thank you so much.